In the second video, I want to talk about the time frame in which the disease and actually the virus develops. So if you have many people sick, you can build a simplified model, and because so many people are sick, it actually might work out. But still, every disease in every person is different. So every person has its own disease history, and some people have a longer incubation period, some shorter. So there, of course, it differs, and we have a limited amount of data about these time frames: how long it takes from being infected to being sick, how long it takes from being infected to die, and so forth. So, of course, it will differ, but if you have many cases, you will be able to find an average, and with a limited amount of data, I estimated a simplified model for this time frame how the virus develops. And what we now know, it seems to be like this: you get infected, you don't know that you are infected because you have no symptoms. As it seems, in this incubation period, you cannot spread the virus, okay? So you don't know you have it, you cannot spread it, but you are a carrier. 1 week later, incubation period is often 5 days, but sometimes also 2 weeks. So for my simplified model, I thought about 1 week later. You might have symptoms, you will be sick, okay? You might have symptoms or not, but you can spread the virus, okay? Sometime later, you might need to go to the hospital and even to go to an intensive care unit. For my simplified model, I thought 2 weeks after infection. And then sometime later, you might die. For my simplified model, I calculated like 3 weeks after infection. I will calculate the death rate in a later video, but for now, it seems to be reasonable to think of a death rate. It will differ, of course, for different demographics and so forth, but for death rate of 1%. And and 6% of the people might need intensive care unit, okay? So the death rate, of course, will go up if your healthcare system is overwhelmed. The intensive care unit number will go down because if you have no intensive care beds free, in the statistics, the numbers won't go up, but just because you have no beds. But in the beginning, when the virus spreads and the numbers are undistorted, you will have several curves, the same curves actually, with a time latency for being infected, for being sick, for being needing an intensive care unit bed, and for being and for dying. Because these numbers, until they get distorted because your system is overwhelmed, these numbers are like 1% of the people die. So if this stays constant and the infected goes up, like a time period later, I estimated now 3 weeks, you will have the same curve going up with people dying. Okay, I painted it here. So you have infected people. This is the time, okay? This is the people, how many are infected. It ramps up, okay? You have more and more infected people. You don't know how many people are infected because they have no symptoms. They don't know, nobody knows, okay? 1 week later, people get sick, okay? They might have no symptoms and not know that they are sick, but they can spread the virus now. They are infectious and they might actually have symptoms. 1 week later, I actually had a dotted line because in Germany test takes 3 days on average. So, I will talk about this in a later video. But for now, you have to understand that if you test, you have 10 days after you being infected, you can know that you are positive. Okay, and also you can only know how many people have been infected 10 days ago, right? With this testing. There's other methods I will explain later. But what you have to understand. So there's this dotted line, depends how fast the test is. This is the tested people. And then the same line, like the infected people, only 6% of the value, and 2 weeks later you will have people who need an intensive care unit bed. And then even 1 week later you have the same curve, only 1% of the amount, and 3 weeks later of people who die. But you have the same amount of growth. It's 27% each day for people being sick, for people needing an ICU bed, and for people dying. Okay, so if you have 100 dead people in your country, you have 100 deaths of corona, and some regimes might hide the number of people dying from corona. Some countries with a poor healthcare system might not know that people died of corona, but in many societies, like European societies, for example, this number seems to be it's easier to know this number than to know the number of the really infected, or because you don't know how well your testing is and so forth. I will explain this later. But for now, if you have 100 dead people, okay, you don't check the virus, you don't change anything, it will grow exponentially. So every 3 days your number will double, or as we've seen in the first video, after 1 month it will be 1,000-fold. So if you have 100 dead people in your country and you think the flu, so many people in your country die every year from the flu, if you don't check the virus, 1 month later you will have 100,000 dead people, okay? Even more, because if your healthcare system is overwhelmed, this number might be 4 times higher, so you might have 400,000 dead people. This is how the virus works.